Replacing house calls with phone calls. Before the break, we showed you how patients in the Triangle are using the latest technology on their phones to send information to their doctors faster than ever before.
But what are the risks as this becomes more widespread? WNCN's Michael Hyland explains.
From phones to Fitbits, there's all types of tech to track your health.
We put all the safeguards in place that we can here, and we protect the data.
Ricky Bloomfield at Duke Medicine is working on expanding the use of Apple's Health Kit to let more patients send their vital stats to physicians from home.
We actually have patients sign a form so that they understand the risks associated, because anytime you have data on a device, there are always risks. There's nothing we can do about those risks.
As Apple developed Health Kit, the Federal Trade Commission raised concerns about what would happen to users' data. Commissioners became satisfied that Apple's privacy policy would prevent app developers from sharing info with third parties.
Things are not as private as you may have thought.
Craig Petronella heads up Petronella Technology Group and is an expert on cybersecurity.
Every text message, every email they've ever written is all unencrypted on that device.
He says despite preventive steps companies like Apple and Google take, there are still ways to get that information.
The part that Apple and Google will never be able to stop is the ability for any malicious user to add that app in that app store and to be able to essentially build that bomb or build that rootkit that has the malicious intent to do what you just said, basically steal that information and send it to a third party.
A group in California studied mobile health apps. They found 26% of the free apps had no privacy policies at all. Beyond that, 39% of them sent data to a third party not disclosed by the developer, either in the app or in a privacy policy.
Your name, your address, your phone number, your birthday, your social security number, whatever potentially private information that you're typing in, it's unencrypted, which is why it's unsafe.
Researchers in Illinois also found while some apps may encrypt information as it's sent over the internet, that info ends up being stored by a third party.
Data breaches is really part of the world that we live in right now. There's a joke that there are two kinds of people in the world, those who have been hacked and those who don't know it yet.
Petronella showed us cyber attacks as they happen in real time.
Number 2 is the United States' most attacked country at the moment.
He says overall, sharing medical data has benefits, but more will need to be done to protect patients.
It is a good thing potentially, but there needs to be an overhaul of the foundational security. So there needs to be an overhaul of the kernel, the operating system, and how it's taking the data that you're typing in. That needs to be encrypted.
Michael Hyland, WNCN News.
At Duke, all the information patients send is considered part of their medical record, so it's kept private and cannot be shared. But there are a variety of steps you can take if you use these kinds of apps to better protect yourself. We've made all of that available on our website. Just go to WNCN.com.